Well, good afternoon. My name is Andrew Cyrick, and I'm a Senior Healthcare Data Analyst at Superior Health Quality Alliance. Today, we'll be doing a KeyMetrics overview just to give you guys a little understanding of how the data collection and reporting tool will work. Before we begin, I just want to mention a few housekeeping rules. Please mute your microphone to reduce background noise. We are recording this session, and it will be used for later use inside of KeyMetrics. If you have any questions, we ask that you please use the chat window to submit that question. There will be a 10-minute interactive Q&A session at the end. And then if for some reason you do experience technical difficulties, please use the chat window and a member will assist you. Our objective today for the training is to help you guys understand how to set up an account and then how to access KeyMetrics. You'll also learn how to enter data for the scope of work and then locate and use any educational tools and resources inside of KeyMetrics. Now, since it is a live walkthrough, I will be transitioning over to the web browser so we can understand how the system functions. Just to give you guys some information, I did include the link inside of the chat window. And then we will be sending a follow-up email to participants just sharing additional information, and I'll be sure to include the link there as well. Okay. So the first thing that you guys are going to need to know is how to actually request access to KeyMetrics. Now, once you get to the home page here, you'll see at the bottom there is a request access link. So you'll go ahead and click that, and it's going to bring you to another window that will prompt you for your email address. So I'm going to go ahead and enter my email address and hit next. And from here, it's going to bring up some additional prompts that are going to ask you for identifying information. So for example, you're going to go ahead and fill out your first and last name. You're going to establish a password. Now, I'm going to be upfront that this information can be a little difficult for the system. We have a password in place that is meant to help make sure that the site is HIPAA and FSMA compliant. So what that means for you is you're going to want to use more of a passphrase instead of a general password. The nice thing is that over time, you won't have to actually change your password. So once you set it, it's going to remain the same in the system. And because of that, we have what's called two-factor authentication. And what this does is when you log in, it's going to ask you to enter in a code. So I'll walk through that a little here in a moment, but that will show you once you enter the code, whether you're going to receive that by text message or email. Below that, you're going to select the managing organization, which will be Superior Health, and then you're going to select your applicable project. And in this case, it's our Quality Innovation Network Quality Improvement Organization project. And then you're going to enter what facilities you need access to. Now, this may vary by individual user. Some of you may only need access to one facility. Others may oversee multiple facilities, and you'll want to know all of those inside of the system, so that we can make sure we provide you with the appropriate access. And then, of course, providing your job title and then a phone number. And as I mentioned with the two-factor authentication, you'll select whether you want to receive a text message or an email for that code, and then you'll be able to enter that in. From there, you'll hit next, and after that, the system will then prompt you, letting you know that you have submitted your request, and then you'll get an email confirmation later once your account has been approved by the administrator. So after you have the code, you're going to be here on the sign-in page. And you'll go ahead and enter in your email and password, and then hit next. And as I mentioned, the system is going to prompt you for a passcode. So in this case, I have selected to have mine sent to my email. I check my email, and I now see I have the code in my inbox. So I'm going to go ahead and enter that code and hit submit. So after that, it's brought me to the website. Now, I do want to mention that once you've entered the code for the two-factor authentication, typically you will not have to do that process again unless you change web browsers, use a different computer, or for some reason log out of the system and then it prompts you for that code again. Typically you'll be able to log in multiple times after you've entered the code once. So the setup here is on the main page. It actually opens up to where all of our surveys are. And I'm going to walk through kind of the layout of this main home page here. So as you can see up at the top, we have a couple different menu options here. Surveys, which is the main page that we are currently on. You'll also see that you have a reports tab, an education tab, and a resources tab. This is kind of some of our navigation menu bars here at the top. I'm going to talk about those here shortly, but I want to focus right now on our surveys page. So on the surveys page, you'll see that we have several drop downs and things here. And then below that is actually the surveys where you'll be entering the data. So in this case, you can see that right here, my top section is my project. Below that is the individual survey. And then these are the actual organizations I have access to. So the nice thing is I can filter down to these specific groups if I want to look at something for my facility. Now, in this case, you can see there's only one entity here. But as I mentioned, some of you may have additional facilities and all of those will be listed under each individual survey. So at the top here, I may want to filter to a specific project. And then if there were a certain survey I want to filter to, I can also do that. The nice thing is our system is set up so that if it's set up so that you only need to look at the information you need to complete. So for example, things that have not been submitted yet are going to show up on the page as the default. Now, if you want to see information that has already been submitted, you'll change this data status to all. Then you can go ahead and hit search and it will update that. Now, as I mentioned, the way that it's set up is you have your project, your survey, and then your facility. So I want to show how you would actually go in and enter some of this data inside of KeyMetrics. So one that I want to focus on here is goal 3, and that happens to be our cardiovascular disease. So I'm going to go ahead and open up Midwest Superior Care Center. And what that does is it shows you the different options that are available for data entry. So in this case, this particular survey is set up on a monthly basis. So you can see that as I open up my facility, it now gives me some additional field headers here. So I see the period, which as I mentioned is monthly, the number of completed fields I have for this particular month, how many fields are remaining, and then the status of that month. So the first thing I want to focus on is the status. Now, inside of the system, we have set up different due dates and lock dates. And this is to help you guys understand kind of keeping track of what that data submission timeline is going to be. So for example, we will include a due date and it will tell you how many days out until that information is due. And then once that due date has passed, it will transition over to a lock date. Now, after the due date, you're still able to edit any information that you've submitted. But after the lock date, that data is locked and you can no longer edit that. So we wanted to make sure that we clearly call that out here inside of the system. We've also included the completed and remaining fields here because I thought that was important for you guys to know how many points you still need to complete for. So in this example, if I look at September, I can see that I've completed 7 of the 11 fields. So I know that I still have some data points that I need to submit inside of the system. And then I can look at down the page and see that I still have several other months that need to have that data completed. So what I'm going to do is I'm going to click into August and help you guys see what the actual data entry is going to look like. So inside the system, you can see at the very top, we have the particular survey name, the submission period, and then what the entity is. below that, we have the actual data submission fields. So this includes your numerators and denominators for the specific measures. Now, one thing that we've done to assist our members with understanding what some of these different surveys mean is we've included these numbers here. And what this correlates to are the different Encyclopedia of Measure documents where they actually include some of this information there, so you guys can correlate what these different measures mean. So we've tried to provide lots of information here about what some of these numerators and denominators are, but we also have those documents that you can correlate with, and these numbers just help you guys more easily connect those data points. So as I mentioned, you can see here we have different numerators and denominators for the measures that we're collecting as part of this program. So the header here will actually tell you what those numerators and denominators are. And then we've also have an option to include what we call a hint. And this is where you'll see some additional information that may help with what this particular numerator or denominator may be. And you can see that the way the system is set up is it kind of walks through by the different measures that we're collecting. So what I'm going to do is enter a few data points to show you how this functions. So if I enter a numerator here and a denominator, and I can do that for a couple different measures here. So after I've entered a few data points, I may not have all the information right now. So the nice thing is that I can scroll down to the bottom and click Submit Survey. And what this does is it saved my information. Now it's brought me back to the main survey window. And since I know I want to look at specifically goal 3, I'm going to go ahead and filter to that. So I'm going to find goal 3 cardiovascular disease and hit search. So that made it a little easier instead of me having to filter through the list. So now I can go ahead and click my facility again that I want to enter data for. And I can see that in August, I've submitted 5 of the 11 fields. So I know that I still need to fill out some more of those. So I'm going to go ahead and click edit and go back into this. Now, the nice thing that you can see is after I've entered these numerators and denominators in, the calculated field has now populated. So it tells me my rate for this particular measure, which is pretty handy. And you can see that that is noted here. And I can actually hover over this and see what that particular calculation happens to be. So it kind of gives you an idea. And we've also included some additional information here in the header, just to support you guys a little better on how that calculation is completed. The nice thing too is, depending on your facility, you might have more than one individual who's actually entering data inside of KeyMetrics. So for example, if I want to see some of the past history, I can go ahead and click this little clock here, and it's going to open up a new window and tell me what the value was, who updated it, and when. So I can see that historical data entry, which is pretty nice. And then as I mentioned, if I have more data points, I can go ahead and include that additional information. So maybe now I know some of these numbers for data entry. So I'm going to go ahead and pop those in. And then again, I'll go ahead and submit the survey. Now, the nice thing is that since last time I said I want to look at this specific survey, the system keeps those parameters. So I don't have to go back and research for it. It's already here. I just open up my entity, and then I can go ahead and look at that particular month again. And again, I can see the information I've entered. And then if I had questions about maybe who have entered the information, I can go ahead and look at the clock. Now I want to just take a minute to see, Michelle, are there any questions in the chat window?
No, Andrew, there's no questions at this time.
Okay. Thank you. Okay, so that gives you kind of a basic overview of how you'll actually enter data points into the system. But now you may be wondering, okay, that's great information, but how do I know what some of the specifications are for entering this? So that's where we've actually included additional resources inside of the site. So if I go in to look at a specific survey and I need to get back to the home page, I can just click this surveys button here, and it's going to take me back out to the main page. Now, as I mentioned, you might need to understand those measures. So what we've done is that's where we're going to come and talk about some of these different buttons and functions up here at the top. So we've included an education tab here, and this just is where we're going to be posting videos on how you guys will actually use the system. And as we get more data into the platform and we have more of the reporting side of things, we'll post additional videos here so that you guys can watch those if you had questions. And it's nice to have those as a reference and a resource as you start walking through this. So as I mentioned, we'll begin to post additional information here in the future. And you should have some videos and things once we do provide access to the site. So we'll make sure that that's available. And then, as I mentioned, the resources page is where we're going to house all of the Encyclopedia of Measure documents. So as I mentioned before, some of those numbers that correlate with the different surveys, that information will be inside of these different goal documents. So for example, I know goal 1 happens to focus on behavioral health. So I can go ahead and click this link, and it's going to open up the PDF document inside of KeyMetrics so that I can see the information associated with the various measures. So as I mentioned, you can see that those numbers correlate with the different measures, so that there's just a way for you guys to connect the data entry point survey inside of KeyMetrics to the actual Encyclopedia of Measure document. So if I had a specific question about one of these, I can go ahead and look at this information and then see what specifically I should be collecting for some of the numerators, denominators, and then those rate calculations too. And then there is additional information about the measure itself. Maybe if it's something that is claims-based, it'll tell you what codes are associated with that. And then if it's manual entry, it'll give you clarification on what you should be looking for, maybe inside of the medical record or other sources. So this will be a great resource, and we'll be updating and adding the final documents before we provide access to you guys inside of KeyMetrics. Now, as I mentioned, there will be a reporting side to this. So right now, we are still in the process of collecting data. So the purpose of today's webinar is to give you guys an introduction to KeyMetrics so that you can see how to enter data. Some of the measures are claims-based, but some of them are also manual entry. So what we'll be doing is, as we collect the data over the next 2 months, we'll be looking to build reports based on that information. So in the future, there will be a reports section here. Now I've set this up and included this as a placeholder, but as we get the reports available, we'll include that here. So you'll see there's a drop-down menu, and then you'll be able to click that specific dashboard title. And right now, as I mentioned, we don't have the reports developed because we need the data to do so. But in the near future, once we start developing those, we'll have additional trainings on how to access the dashboards and then how to actually use those dashboards, navigating the information, what is available inside of the reports. And a lot of this will be very beneficial to you guys because all of the data you've been entering inside of the system will be available on the reporting side. So you can do some comparison against different cohort groups, maybe those inside of your particular state, those who are very similar in entity type or maybe bed size, certain things like that. So as I mentioned, more information to come on the near future on that. So that's mainly the information that I wanted to share with you guys today. Are there any additional questions you guys have about the system so far?
There's not any questions yet in the chat. So people, if you have any questions, you can put them in the chat or you can unmute your microphone and feel free to ask the questions directly. In the meantime, Andrew, I don't know if there's any questions that you frequently get. You probably covered those kinds of things in your presentation, but I'm just curious if there's things that you commonly get asked.
No, sometimes it's maybe understanding how to access something that's been submitted already. And I don't necessarily have an example of one that's complete. But as I mentioned, if it's not showing up in your list, it's more than likely because it's already done. So in that case, you would just filter to the all and then search. And you'll have the ability to go back in and actually edit that information. And I think that can be confusing for participants sometimes, because when they see it's gone from their list, they think, oh, I'm not able to go back and edit that. But you always have the ability to edit after a due date. But once that lock date is hit, you won't have the ability to do so. And the system, again, will show you this month or quarter has locked, and you're no longer able to edit that information. The site is pretty easy to navigate. I think a lot more of the functionality side of things is going to be when we get to the actual reporting piece, so you guys can do some comparison with the data that we're entering. So again, it doesn't look like there's anything in the chat window. I'm not sure if there are any questions. As Michelle mentioned, you can feel free to unmute yourself if you just want to ask something about the system or clarify some of the functionality.
Andrew, I did get a question kind of more directly to me, but maybe this is something that you could speak to is, is there any way to, if you had to enter a bunch of data at once, not just go in and do a month, but let's say you had to go in and do all of the baseline time period, is there a way to kind of submit a bunch of data, in an upload or a batch submit?
Yes, so we do have the ability to do a batch submit, and I will walk through that right now just to help you guys, because I understand that we will be entering baseline data here soon, and that may be an easier process. So as I mentioned, you can filter down based on project or survey. So in this case, I'm going to select my project. I'm going to use the Goal 3 cardiovascular disease survey as an example again. I'm going to go ahead and search, open up my entity. And the nice thing is if I scroll down a little more here toward the bottom of this list, I can see that I have the ability to do a bulk edit. So if I click this link, it's going to show more of a all-encompassing view of the data points that I need to submit still. So you can see that for these particular months, I've already submitted some data here, and it shows up in our list. The nice thing is that I can then add in on the additional information for my facility. So if I go ahead and scroll down, I can see all of the individual measures for this particular survey, and then I can add that data here. So this is a little bit of an easier way for you to add larger amounts of data. The system does have the ability to do imports. We're not going to walk through that today, but that will be something we can cover in a future webinar. And then it's very easy to walk through. You can tab over to the different pages, or you can use your arrow buttons on the keyboard, which will help you scroll back and forth to see your individual months that you can submit data for. So yes, thank you for that question. That's a great point. And then when you're done, when you're done here, you can go ahead at the very bottom. Again, there's the submit survey, and that will save your submissions. Go ahead, Michelle.
And kind of an add-on to that question was, if you're entering, you're part of a clinic system and you're entering data for multiple clinics within that system, is there a way to kind of do that in a batch versus entering it in clinic by clinic? Would that be in the import, or is there a way to do that?
Yeah, and that might be something we can talk about with the import side of things. For the most part, we have the bulk edit inside of here, and that would be going more facility by facility. So again, if I had multiple in here, I'd see more in my list. So I could open that up and do the bulk edit. That might be something for this particular individual who has multiple sites. Maybe that's something you could reach out to me directly and we could talk about the best way to get that data in. And I'll be sharing my contact information here in a moment. Are there any additional questions about the system itself? Well, what I've done here is I put my contact information up on the main page. Like I mentioned, for that individual who does have maybe several clinics that they want to enter data, we can look at potentially doing the import template, because I think that might be of benefit for you. And as I mentioned, the import template is something we can make available. That's something we are working to develop. And then we can have, again, a separate webinar about how to actually complete that.
And then just in case there were people that joined late, I put the link to request access, and again in that. So when you request access, we plan to, I think, do you remember the time that we plan to kind of, once somebody requests access, when we were going to give them permission to get into?
So obviously today we're doing the webinar just to give you guys the intro. You can go in after this and request access to the system. And what we're gonna do is on October 1st, we'll begin approving all the users into the system. So we're finalizing a few documents and things to get those resources ready for everybody. And then we'll be approving access by October 1st. So that'll give you all plenty of time to enter data. Baseline data is due mid-November. So we want to make sure you guys have adequate time to get that inside of KeyMetrics. So, and as I mentioned in the beginning, we will be sending a follow-up email out to all of the participants on the call today. Just again, sharing the link to the website and then some of those upcoming dates for you guys. So you're at least aware of the timeline on when you'll get access to the system and then when that baseline data is due. Okay. Well, Michelle, if there aren't any additional questions, I think this is a good time for us to end the call.
Yep. Yeah, I'm not seeing any more questions. Yeah. Thanks, everyone.
Okay. Thank you all for joining today. And again, my contact information is here on the page. So if you have additional questions, feel free to reach out to us, and more information will be coming via email in the near future.